People tend to think that the most of the contribution to infertility is coming from the female. However, a third of the cases will come just solely from the males, and a third of the cases from both of them. So we can actually say that 40 to 50% of the cases of infertility are contributed by males, which means that the investigation of male infertility should be a first priority as part of the initial investigations of the couple's infertility.
There are many causes of male infertility, but there are also other causes that we don't know so far. But in most of the time, we initially do a semen analysis, and that will guide us toward, after this, what investigations that we need to do. Sometimes it can be due to hormonal disturbances or hormonal deficiencies, or due to chromosomal abnormalities, and the most common reason for that is Klinefelter syndrome, for example. Lifestyle is very important here. Being overweight can affect the hormones and can affect the semen quality. There are also other causes that can be related to having a blockage in the tubes which connect the sperm from the testis to the outside.
When we investigate male infertility, we are looking at few important parameters. One of them is the count of the sperm. The other one is the ability of the sperm to move. And the third one is the morphology, or the shape of the head and the tail of the sperm.
There are lots of lifestyle factors which affect male infertility, and the most important two lifestyles is the obesity and smoking. Obesity will affect the sperm formation by changing the hormonal milieu inside the body. So there is here excessive conversion of testosterone or androgens to estrogen, and this is not good for the sperm formation. So losing weight here can normalize that equation. The other factor which is important too is smoking. We know for years that smoking can affect the parameters of the sperm through different mechanisms, and one of them is damage to the DNA of the sperm. And there are recent studies that has shown that the offspring of couples where the partner is excessively smoking can have higher risk of having childhood cancers. One of the important breakthrough in the management of infertility in the recent years is the introduction of ICSI, or intracytoplasmic sperm injection. And here we have the ability to only use one sperm and inject it inside the egg. And that can result in fertilization and an embryo that can be transferred and give you the child that you want.
In light of the major contribution of males to infertility in general, and we know today that 40 to 50% of the contribution to infertility is actually coming from the male part, it's obvious, and I think it's reasonable to ask the men as part of their basic investigation to produce a semen analysis to rule out this contribution to the infertility.